You're listening to Hold On a Minute, a podcast by UNFPA Asia and the Pacific. This podcast series presents inspiring and powerful stories on the sexual and reproductive health and rights of women across the Asia-Pacific region. I'm Pupei Chaworatyong Jiranon, your host. On this episode of Hold On a Minute by UNFPA Asia Pacific entitled Invest in Her, we discuss the economic benefits of investing in the sexual and reproductive health and rights of women. The United Nations Population Fund, or UNFPA, is the United Nations Sexual and Reproductive Health Agency. Its goal is to prevent unintended pregnancies, reduce maternal deaths, and prevent and respond to gender-based violence and harmful practices. The achievement of these three transformative goals relies on the realization of sexual and reproductive health rights, which is a basic human right. This requires investments at every stage of a woman's life, from infancy and childhood to adolescence, adulthood, and post-reproductive age. Investing in women's sexual and reproductive health means investing in her physical, emotional, mental, and social well-being in relation to all aspects of her bodily autonomy. However, UNFPA cannot do it alone. This is why the organization is calling for governments and the private sector to increase investments in this area. This is imperative to increasing and improving the availability, acceptability, and affordability of quality services. For an example of how investments can make a difference in women's lives, let us listen to the story of Dara.
My name is Dara. I am 35 years old, and I am a doctor. I've been incredibly fortunate to live a life filled with opportunities, thanks to my parents' determination and sacrifices. They grew up in a humble village, but when I was born, they made the bold decision to move to the city so that I could grow up with access to quality education, healthcare, and a chance to reach my fullest potential. I was still a baby when we moved to the city, but I have heard stories of how my parents worked tirelessly to provide for our family. They instilled in me the belief that with their support, hard work, and the resources at our disposal in the city, I could achieve anything. My education was a priority, and I was lucky to be able to attend one of the best schools in the city as a young girl. My passion for learning blossomed, and I knew that my dream was to become a doctor. I often visit my cousins in my parents' village, and I really wanted to become a doctor so that I could help those who did not have access to quality healthcare. As I matured, I faced a significant decision about my reproductive choices. My parents, who has always explained the importance of making informed decisions, made sure I had access to comprehensive sexual education at school. At home, they had open discussions with me as I was going through my teenage years, as they wanted me to understand my options fully and choose what was right for me. I was grateful for their openness and support, knowing that my choices were mine alone. In college, I pursued my dream of becoming a doctor. I graduated with honors and become a medical professional, living the dream I had nurtured for so long. While my career thrived, my partner and I decided to delay starting a family until we were financially stable. Access to contraception methods gave us the freedom to plan when parenthood was right for us. Meanwhile, my cousin, who had remained in the village, faced a very different reality. Limited access to quality education and healthcare constrained her opportunities. She married early and started a family, following the path that was shaped by circumstances beyond her control. Looking back, I realized the stark difference between my life and that of my cousin. Our paths took two different routes because of the opportunities, education, and access to healthcare that I was lucky to receive. I am forever grateful for my parents' sacrifices and support, and to the city education and health system that transformed my life.
Hold on a minute. The story doesn't always end like this. It is clear from Dara's story that investing in the sexual and reproductive rights of women does make a difference. To learn more about the impact of investment, I'm joined by two individuals working to increase the rights of women. UNFPA Asia Pacific Regional Office Health Economics Advisor Davide Di Beni and Genesis Analytics Managing Partner Thomas Levens. Davide joined the UNFPA Asia Pacific Regional Office based in Bangkok in September 2019 as a Health Economics Advisor. He provides technical support to the region on health economics and financing matters concerning the UNFPA's mandate areas. Over the span of 20 years, Davide has worked in developing and supporting economic and financial analysis across Europe, Sub-Saharan Africa, Asia Pacific, and the Caribbean. He has worked with the World Bank and other UN agencies. Thomas Levens is the managing partner of the human development practice of Genesis Analytics. He has experience in social policy in the areas of health, education, and social protection and poverty. Prior to joining Genesis, Thomas has worked with Oxford Policy Management, the International Labour Organization in Africa, and the Belgian Ministry for International Development. Well, it's a pleasure to meet both of you here on our podcast. Hello, Davide. Hello, Thomas. I think I want to ask Thomas you the first question, because when we take a look at Dara's story, it's a great example of how a woman can fulfill her dreams through quality access to education and healthcare throughout her life. She mentions that her parents grew up in the village and that they moved to the city so that Dara could fulfill her dreams. How and why are the quality of service different in cities? We've seen in her story that there is a stark difference.
Yeah, that is something you observe a bit throughout the world, and you can try to think about it in the following way, at least. So the access or sexual and reproductive health rights are part of the Universal Declaration of Human Rights. So we collectively believe this is really important. That has then been translated very often in constitutions at national level, where governments and states say, yes, we recognize that, and we will do whatever it takes to actually ensure that our populations, those living in rural and urban areas, have access to or realize that right. Now, what is really important to realize is the way this happens is through access to services, right? That is how you realize these rights. And these services in broad terms are information. People need to have the information that is provided through education systems and others, actual health services, but also access to products for family planning. Now, coming to your question, if you look at the distribution of these services in countries, right, they are offered by private providers and public providers, and private providers are more dense in urban areas. And they're more dense in urban areas because that is where populations live that can actually afford them. So what you can get is a natural tendency for people living in urban areas to have more choice when it comes to providers. But if I may, that is not the only thing. The supply is not the only thing. There is also the demand, the populations themselves. And in order to access these services, you actually need to be fully informed about the need for these services. And also your cultural norms should be supportive of doing so. And what we also see is that both the availability of information and the predominant norms in the rural areas is actually biased against accessing these services. You've got a double reason. Less services available in rural areas, and the populations living there actually be less informed and less inclined to use them.
Very interesting that you point out that there are two factors. You would think that obviously there's more services in urban areas, but with that mindset of, the rural areas not knowing what they need, that's a very interesting point. Now, in addition to the rural versus urban divide, what are the other factors affecting the ability of women and girls to access quality sexual and reproductive health services in the Asia and the Pacific region?
Yes, this is actually a very interesting question, because the rural-urban disparity in access to services is part of a bigger picture. And the bigger picture is actually how sexual and reproductive services and information related to them are financed. And as we said before, they are offered through public and private providers, and typically the private providers are paid for. So you immediately see a picture where the financing of all these services are done both by the people themselves and also by the state. And to put a number to that, of the total health expenditure in much of Asia and Pacific, 49% is paid for by people out of their pockets, right? And so what you see, again, as I sort of hinted at before, is that richer populations or urban centers contain, on average, more richer populations than rural areas. And that explains why private providers will go where people live that can pay for these services. So I'm inverting the logic. And conversely, they do not go where people cannot afford their payments. So the bigger picture that emerges is that it's not only rural, urban, but it is also rich, poor, where you see the disparity between access to these services. And that is really an important notion where the state, as I said before, in its constitution has often guaranteed access for all the population to these services to realize their rights, needs to use public expenditure to correct, right, on these sort of organic or natural tendencies to create disparities in access to services across the population and therefore rights realization across the population.
No, I think it definitely is a pivotal point in terms of seeking or seeing where the money or the funding is coming from, because it does make a difference, right, Thomas, as to how it is implemented.
Yes, yes, absolutely.
Now, Davide, when we take a look at the challenges that we have, addressing these challenges means that, countries should invest more resources in these areas. What is the UNFPA doing right now to help countries prioritize financing sexual and reproductive health?
Thank you for the question. So UNFPA, as you know, is the UN Sexual and Reproductive Health Agency, and we aim to prevent unintended pregnancy, reduce maternal death, and prevent and respond to gender-based violence and other harmful practices. So indeed, to achieve all these ambitious goals, countries should invest more in this area. And we do know that traditional mechanisms for financing these goals are not sufficient to meet these needs. And that was the case even before COVID. I think partners have estimated that around $1 trillion US dollar was required to achieve the 2030 agenda. But after COVID and with consequences of the polycrisis, as we call them, right? The consequences of the conflicts and the inflationary push, this number have been revised upwards. Now we estimate that more than $3 trillion US dollars are required to achieve the Sustainable Development Goals, so more than 3 times. And for UNFPA, we also try to estimate what is required, and that's significant. For achieving the 3 transformative results, as we call them, the one I described earlier, we think that we need around 26 billion US dollar annually. But out of the 26, we only have 4 from international donors across the globe. So where is the other 22 billion coming from? And it's a significant amount. Well, this is what Thomas say. I think increasingly we expect this gap is filled by partners, by governments from their national budget, so public investments. And this is why UNFPA is increasingly making efforts to convince those partners that health and sexual reproductive health is not a cost, but is an investment. And therefore, it's critical to invest more resources in this area. And this is because we do know, and we have evidence of that, that by providing women and girls access to, for example, to voluntary contraceptive services, we reduce unintended teenage pregnancies. This will help the girls to continue their education, to develop their professional skills, and therefore to increase their economic and societal participations. So, for example, even maternal health, in addition to this pathway, obviously addressing maternal health will save life. We will have healthy babies, we have healthy mothers, and we will be able to continue to fulfill their dreams and participate in the society. And this, if you look at it, it is exactly the story that Dara told us. And what UNFPA is doing, in addition to this, is actually we are able to quantify exactly what is this economic impact, longer-term economic, positive economic impact. And we do so developing investment cases where we quantify exactly what is the return of investing in the three transformative results. We've done so, for example, in 120 lower and middle-income countries globally, and it turns out that investing in preventing maternal death and unmet need for family planning by 2030, investing $1, we will get $8 in return. For addressing female genital mutilations, the returns is even greater, so $10 for $1 investment. Invested, and 33 to ending child marriage. So the question is really here, why not investing in the social sector, in health, and sexual reproductive health? Because this is clearly the best way to recover from the pandemic and the other socioeconomic crisis that we are witnesses across the globe and in this region.
Well, thank you, Davide, for clarifying it and seeing how it is very clear how the proper investment or the proper funding really brings about the results that is needed. And both, you and Thomas has been very clear as to the important role of the public sector in playing a bigger role in improving the quality, access, and availability of health and education services for women and girls. But then on the other hand, in our society, we also have, the private sector, right? So the question is it only the responsibility of the public sector, or what can the private sector do to ensure that women can exercise their sexual and reproductive health rights as well? Davide?
Sure. As I said, the financial need, the requirement are massive, right? So public sector alone is not sufficient to fill those gaps, those financial gaps. We also know that the private sector can play different roles and is a strong ally to UNFPA on delivering our mandates and achieving our goals. So the private sector, for example, could be the actor delivering health services sometime and think of pharmacies, private hospital, and so on. But they can also be partnered through their social corporate responsibility programs. They could also be partners in facilitating the delivering of our programs in their premises, in their workplaces. And this is particularly important in a region like the Asia Pacific, where the garment and manufacturing sector employs literally millions of women across the region in countries like Bangladesh, Cambodia, Vietnam, Indonesia, etc. Many of these workers lack adequate access to services, basic health services, including sexual and reproductive health services. Many are women, often young women, that migrated from the rural area to the cities. And they don't have the possibility to pay for these services, the knowledge to know where these services are. Therefore, this is a space for partnership, working together with the private sector, with the businesses, to deliver program like awareness of service provision in their factories, aiming to increase, at the end of the day, access and reach for these services. And this is what UNFPA is doing in this region. And we are doing it in a different way. One way, for example, is estimating what are the economic and financial return for the business in terms of increase in productivity for the private sector, decrease in absenteeism, for example. But foremost is to demonstrate that we will have healthier workers, more empowered workers, and therefore more productive and benefit for the business as well.
Massive task indeed, and the challenges is quite large in itself. And thank you so much for clarifying that. When we take a look at, there are a variety of different challenges when it comes to addressing this issue. What more needs to be done to address the challenges in the Asia Pacific region to ensure that women and girls, enjoy equal opportunities in society? Thomas?
Yeah, it's indeed a big challenge, and I would sort of like to pick it up where I left it before, and where you were heading me with your question then, which is to say that is actually the role of the state to ensure that everyone can realize these rights. And then I pointed out that practically that happens through access services, and then the important condition for making sure these services exist is money. Right? That is making sure there is enough money to finance the service that people that can access. And I would like to answer, if I may, your question by also promoting a little bit a learning program that UNFPA has set up. It's called the Learning Program for the Financing of the Sexual and Reproductive Health Rights in Asia and Pacific. Because I think it answers your question, if I may. So the learning program, importantly, is targeted at decision makers. So it is decision makers that ultimately make the decision to ensure enough money is made available for these services. Who are these decision makers? There are of two kinds, essentially. They are the legislative, the parliamentarians, who ultimately are the most important representatives of the people. And then secondly, and in tandem with them, the executive, the governments, ministries of finance, but also the implementing ministries like the ministries of health. So these are the two big target areas of the course, surrounded by the stakeholders, including the private sector, because they all need to work together. That's one point I want to make, the private sector in the countries, but also the donors, and we will come back to that quickly. And the course is actually designed to identify the entry points that governments and executives have to ensure financing for the services is available. And so the course, it looks at the various entry points. And I don't want to be technical, but it's about what is the fiscal space for these services, what is the value for money, the cost effectiveness, the cost efficiency, also the equity, what is UA, the role of universal health coverage, etc. So it goes through all the entry points so that these decision makers have an overview of what they can possibly do to improve financing for sexual and reproductive health rights. If you put that more simply, it is often about spending enough, right, and spending better. And these two components are important in tandem. If you look at spending better, an important element of spending better is to ensure to give a Ministry of Finance options around what it needs to do with what is inevitably limited public expenditure available. And one of the particularities, and this is really crucial, about spending in sexual and reproductive health rights, which is a right, is that in addition to being a right, the economic returns or the investing in it are typically much higher than alternative investment opportunities ministries of finance have. So the story often starts there to really make sure that these decision makers know that this is underfunded given the economic return, let alone the rights return of spending on. So that is often the entry point is spending better. And if you then look at spending more, this is often to do with ensuring that the allocation from within the budget and even from within the health budget to sexual and reproductive health rights goes up. And then I would like to conclude here quickly also around the spending better. So once you've ensured that the resource envelope available for these services goes up to complement perhaps the investment households do through the private sector already in access to these services, right? So that you got a complement between the public and the private sector. It is also important to ensure that you look at other dimensions of spending better. And this goes back to the story of Dara. First of all, you need to ensure that spending available is equitably distributed. And sort of in layman's terms, it means the governments need to target their spending at those populations that are lagging behind. And rural populations would often be a part of those. But it's not a given. Every country needs to figure out who is lagging behind and target programs on that. That is one element of spending better. The second one is do not waste money. Right. It is important that we use the resources as best as we can. So anything to do with cost efficiency, especially in family planning, to do with the procurement of goods of family planning products is really important. And so this learning program, I think, encompasses all the entry points governments have to ensure they spend more and they spend better, which then ultimately allows to ensure that these rights are better realized. And the last point, the very last point, and I know I'm going on a bit here, is that another dimension of the financing of these services are the international donors, right? They do offer, especially for low and under middle income countries, quite a significant complement to available funding in government budgets and in households. Now, what is particular about these donors is they will phase out as these countries become richer. And that is another dynamic element of the financing of these services that needs to be managed quite well, right? It's not only where does the money come from, but it is also changing over time where the money comes from. And if you want to have continuous access to these services, you need to ensure smooth, what we call transitioning of funding sources over time. And this course also deals with that. It gives these decision makers the tools and the knowledge to actually manage that transition. And it's, I think, a course open to all. And if you're interested, I would certainly encourage you to contact UNFPA. My colleague Davide De Benny here on the line can certainly help you with that.
I appreciate that you're taking your time to explain it to us, because often when you talk about these things, they just, the mass majority of the people, on the street, they think that it's just about funding and getting more funding, but it's just more than that. And in terms of spending smartly, making sure that you're using your resources to the fullest in an efficient way, where at the end, the people do, or the country do benefit from that. But it is true, as what you said, it's different from region to region, country to country. And we really do have to kind of discover that path, for each country, to do it by themselves. I'm going to come back to you later, just towards the end here, but I want to ask Davide one of the key main points for, not just only this podcast program or episode, but also in reflection of our previous podcasts in our series, we've discussed the population dynamics in the Asia Pacific region. Davide, what are the implications of aging on countries in terms of investing in sexual and reproductive health? Because that is also a very significant factor.
Sure. So last year, the world reached a population of 8 billion for the first time. And most of this population lives in this region, in the Asia Pacific region. Half of it is comprising of women and girls. And although these figures concern many, this is a positive outcome because people live longer, healthier, neonatal child mortality is decreasing, but also fertility is decreasing in some countries. And this is, so women are having less children. And this is also a positive factor, in my opinion, because often this decrease in fertility is positively associated with increased education for women and girls. But this phenomenon is concerning many society and government in the region, and they're worried that they need to adjust their policy to address new challenges. And what are these challenges? For example, they need to diversify the type of health services to account for an increase in older population. Older population means increasing cost to take care of this portion of the society. And also there is a financial sustainability of the social protection system, things about the pensions. So we are seeing a shrinking working age population, and therefore there is less room for paying for services like pensions of those population that are getting older, and they're increasingly many. And finally, many countries are also concerned about the decrease in productivity of their society for exactly the same reason, because of the working age population is shrinking. So what is UNFPA thinking about it? What are we advising? Okay, our first advice is to continue investing in health services through the life course. So continue investing from the beginning, starting from the mothers, with children, through the life course in preventive healthcare, promoting positive behavior of the population, so they will arrive much healthier when they are older. Another way of addressing the issue of shrinking working age population and decreasing productivity is encouraging women to participate more to the economy, so to work more. And of course, that take place is family and women are supported with adequate family support policies that allow the woman to continue working even when she decided to give child. So I'm talking about parental leaves policy, childcare, taking into consideration the value of unpaid care. But also, and most importantly, continue ensuring the right to reproductive choices. So to providing the choice for women to decide if, when, and how many children they want to have. So in this way, we think that we will be able to fulfill the desired fertility level of the family and the women, as well as ensuring they continue to work to continue to be productive and to contribute to the society in a positive way. Finally, there's also other, we call it innovative financing mechanism that I'm looking at to address the challenging of pensioner, for example. So there are mechanisms like reverse mortgages that allow pensioners to disinvest some of the assets. Think about houses they accumulated during the younger age, and disinvest and be able to spend this money when they're older and they're not able to work anymore. But in general, I think what we try to address is the ability of everyone through the life course to access to quality health, particularly sexual reproductive health education, and be aware that health and education is not a privilege, but is a human right through the life course of individuals.
Well said, Davide, in terms of how ensuring equal rights not only benefits the individual, but also the country as well. And to end off our conversation, I just want to give an opportunity to, both you, Davide, and Thomas, to give takeaways from our conversations for our listeners as to what they should really think about, and if they want to know more information, what can they do as well? Thomas?
Yeah, thanks for the question and giving me the opportunity. What I'm quite passionate about is this is a real area where governments can do a better job, right? It is by spending more on the services, sexual and reproductive health services and associated products. They will ultimately do two things. They will make good on the commitment they've made to their populations to ensure their sexual and reproductive health rights are realized. But at the same time, the economic benefits of doing so are so big that the secondary benefits in terms of, as Davide has said, healthy populations and costs saved in the health system, productive populations that grow the economy, right? Are much, much better achieved. So this is an area where governments can make progress. It is a fantastic opportunity that is still out there in the majority of the countries, even if the exact pathway, as you've pointed out, needs to be charted at country level. And there is a partner, UNFPA, available to work collaboratively with these governments to achieve that, what I think is an exceptional opportunity.
All right, Davide, what can listeners do or how can they find more information about the UNFPA? What should they know about what the UNFPA is doing right now?
Sure, but first, let me say that I totally agree with Thomas, and I often like to summarize in a way what Thomas said, what I said in my previous intervention, that actually health is not a cost, but is an investment that not only save lives, which is a very important outcome, of course, but deliver strong resource for the society and economies. And most importantly, is a human right for all, is not a privilege.
Thank you so much to both, you, Davide and Thomas, for being with us here today. I know the topic is quite challenging to clarify to our listeners. I'm sure that a lot of us have been enlightened with what you've said so far. We look forward to hearing from you and your work. This has been the latest episode of Hold On a Minute by UNFPA Asia Pacific. We hope you have gained an insight into how crucial investing in the sexual and reproductive health and rights of women is. For more insightful episodes of Hold On a Minute by UNFPA Asia Pacific, follow our podcast pages on Spotify, Facebook, YouTube, and Apple Podcasts. Just search for UNFPA Hold On a Minute. See you in our next episode.